Hello there. In the UK, tens of thousands of people are currently waiting more than 12 hours to get medical attention in emergency departments. And now they really sound the alarm there, and Prime Minister Rishi Sunak now promises improvement. According to estimates by associations, 300 to 500 people die every week in Great Britain because they do not receive timely or appropriate care in emergencies. The Vice President of the Royal College of Emergency Medicine, Ian Higginson, confirmed the figures that became known to the BBC over the weekend. He dismissed the suggestion that the difficulties were temporary. When you are there, you know it's a long-term problem, not just a short-term one, he said. In the past week, 1 in 5 patients picked up by an ambulance in England took more than an hour to get to the emergency room. Tens of thousands of patients had to wait more than 12 hours to be treated in the emergency room. You have to believe that. The British Medical Association, a federation of nurses, echoed the alarming statements. It's not true that the country doesn't have the resources to fix this mess, said the chairman, Phil Benfield. It's a political decision and patients are dying needlessly because of this decision, he said. Benfield described the current situation as unsustainable and called for immediate action by the government. The British government blames the consequences of the corona pandemic and the flu wave for the current situation and assures that it wants to do more for hospitals. In his New Year's greetings, Prime Minister Rishi Sunak named the NHS as one of his priorities. But how often have we heard that? The free NHS has suffered from harsh austerity measures for more than a decade, and recently there have been several strikes by healthcare workers, including nursing staff and emergency services. They wanted to increase pressure on the government to raise wages, but not only that, also to improve working conditions. The Conservative government is refusing wage increases despite record inflation of more than 10%. The differences between the German healthcare system here and the British one could not be greater. While here in Germany you have the choice between private and statutory health insurance, Great Britain uses a uniform system. This means that there is no classic health insurance in England. Instead, the state ensures that every citizen has access to medical care and assumes a large part of the costs for it. However, the British have to pay for some services themselves, such as medicines, visual aids or dentures. Nevertheless, there's one big thing in common. Britons have the option of taking out private supplementary insurance or full private insurance to protect themselves against high costs. The first point of contact for health problems is the local family doctor. However, the choice of general practitioners is often restricted and is influenced by place of residence and entry in a special register. Only those with supplementary insurance are really free to choose. Anyone who is referred to a specialist by their family doctor does not go to a practice as in Germany, but to a clinic. Since it can take a long time to get an appointment with a hospital doctor, private insurance also has advantages for patients here. Otto von Bismarck was the father of social health insurance in Germany and gave his name to Otto Nover. He founded the German health insurance system, which is financed from the social security contributions of the insured and enables all citizens to receive basic care. The British health system dates back to a 1940 report by British MP William Beveridge. In it, based on the idea of a welfare state, he proposed giving every citizen access to medical care, regardless of their personal circumstances. The system should be financed by taxes. On his recommendation, the National Health Service England was formed a few years later. In principle, the system is similar to the citizens' insurance that is much discussed here in Germany, which I don't recommend though. The National Health Service England embodies the British health system to this day and is the employer for a large part of the medical staff. Reporting to the government, it is divided into 4 separate institutions for England, Scotland, Wales and Northern Ireland. The NHS organizes all medical care and its funding. The regional organizations decide, among other things, how the services in their region can be best supported and insured. Since it was founded in 1948, there have been repeated reforms and restructurings. In addition to the NHS, there's also the national insurance in England's social system, which, among other things, secures pensions in old age. In the UK, every citizen has a social security number, which is used to register social security contributions to distribute unemployment or old age benefits accordingly. Yeah, I have that number too. The employer also participates in the state provision for old age. The German healthcare system here is financed according to the principle of solidarity. Employers and employees pay into a large pot that finances the basic healthcare. The basic for the contribution is the level of income. Medical advances are primarily financed by private health insurance, where contributions are based on the personal risk of the insured. The welfare system in England is organized somewhat differently. As mentioned before, the healthcare system is not funded by social security contributions, but by taxes. The British therefore pay no direct contribution to health insurance. Instead, the state finances the health system, which is therefore closely linked to the state budget and the government's financial policy. For this reason, there have been repeated losses in the quality of treatment in recent years. The British health system offers citizens medical care that is virtually free of charge, regardless of their personal circumstances. Health spending in Great Britain is regulated by the state and lower than, for example, here in Germany. However, the austerity course regularly takes revenge, for example, when the flu breaks out. The corona pandemic in particular has clearly shown how different the healthcare systems in Britain and in Germany are. While the German system has received a lot of praise from abroad, experts warned of a possible collapse of the British health system at the beginning of the pandemic, and they have not been that wrong. In principle, state-funded care sounds advantageous, and in fact people in the UK are proud of their own healthcare system. But the almost free healthcare is always reaching its limits. The more doctors there are in a country, the better the care works. While the doctor density in Germany is 4.3 doctors per 1,000 inhabitants, in Great Britain only 2.9 doctors are responsible for the care of 1,000 inhabitants. In British hospitals, there are only 6.6 beds per 100,000 inhabitants. In Germany, there are 29.2 beds. The UK healthcare system is short of money, which is affecting the quality of care. With a shortage of intensive care beds and staff, many Britons are waiting longer for surgeries than other Europeans. In the case of non-essential surgery in particular, Great Britain brings up the rear in terms of waiting times. And we are talking about this a lot on my channel. And as a person who has the experience of both systems, especially at the time when my appendix burst, I was very close to die that time, or now when I'm still suffering from long COVID. I am so glad I'm back in Germany and being treated in the German healthcare system, because I have been living in the UK and I know the NHS from personal experience. And so I have a direct way to have a look at both of them. And yes, the German system, from my point of view and from personal experience and from many experts I read about both systems, is the better one. Even if we still have a lot of trouble, there are still things that are not paid for by the general insurance. From my point of view, it should be. And there's still a lot of reforms to be made there. But it's not the worst system. And in Britain, we see at the moment, unfortunately, every day what's going on with the NHS. And I'll see you in my next video. I'll be back.